Well, thanks for rejoining us this afternoon. And once again, thanks to the amazing staff here for the lunch that we had and the service they provided us both at lunch, and those of us who are staying in the hotel appreciate everything they do to make this a place that is safe and comfortable for all. So with that, we are going to move into the subcommittee reports. We are a bit behind schedule, but the good news is these two items that are next on the schedule don't take as long as we put on the agenda. So that should be a good thing for us. We're going to start out with the subcommittee reports, and we'll start out with ending the HIV epidemic in the U.S. and the National HIV/AIDS Strategy. And Carl Schmidt and John Shapiro will lead us in that update.
Thank you, John. And John Shapiro has graciously allowed me to start since this is my last EHG subcommittee report. So the subcommittee continues to meet monthly. In April, actually in response to something that we heard at the March PACHA meeting in DC, where there was a discussion about the Ready, Set, Prep data collection that went out in the Federal Register. We were concerned about that, and we wanted to hear more about that. And we, OASH did arrange a meeting with the staff that was working on it. And they walked through the reasons why it was done, and we were satisfied with what we heard, but it was necessary. All that data collection was necessary to get the drugs to the people and to ensure they did not have private insurance. And we were also assured that that data was not shared with any pharmaceutical companies. And so just wanted to let the public know that we did respond to what we heard during the public comment session. We also had a long discussion with no resolution on a new name for the subcommittee. But you could tell it's a long one, and I think people can get confused because EHG, we only are concerned about EHG, and we're concerned about ending HIV. And you know, some of the things that we would like the new name to maybe recognize the work of the subcommittee really is all the work with the federal partners and community engagement. And so we'll leave it up to the future PACHA to come up and the staff to come up with a new name, but we do recommend that that subcommittee name needs to be changed. In May, we were concerned that we've seen some press reports about some jurisdictions not spending all their EHG funds. And we got a briefing from the OASH staff to talk about that and the reasons why. A lot of it had to do with just state grant processes, COVID, MPOX, just other things going on. One of the solutions that a couple of us came up is, a lot of the money, all the money for EHG basically is going to the states and then out. Maybe there needs to be more money going directly to CBOs in the future. In June, we had a briefing from Harold Phillips on the National PrEP program. And as you all know, and I said, I know this is like my last meeting, and John's going to continue to chair it. But we do have some, priority issues that I hope will be considered. You already heard about the need to address the workforce letter or resolution. HIV and aging has been another thing on our agenda. And one of the things that we didn't get to that we wanted to do was to have a briefing on the AHEAD dashboard to get, I think our last meeting, we heard a lot of federal partners individually, but we wanted to see how it all melds together nationwide. I hope over the last 4.5 years that I've been involved in this subcommittee, we've accomplished, I think 2 goals: to get community involvement in the EHG and to hold our government partners accountable. And I just want to thank all our government partners who participated. And I hope that continues in the future. And we'll turn it over to John to see if he has any additional comments.
I think the only thing that I would add to that, Carl, is a round of thanks to you for the amazing work that you've done as co-chair of the committee, and especially so, over the last few months, where I've had to step back to care for an ailing family member. You graciously have stepped up and done some great leadership work. And quite honestly, when I asked you to do the final meeting update today, it was because I didn't feel confident that I had participated enough that I could provide that update for you. I really appreciate your consideration, your effortless leadership, and the amount of knowledge that you brought from your national work to the committee, and you will be very sorely missed. And I would offer that same thanks to Kay Hayes and Carolyn Talov. You both have been really supportive as I've had to be in the back seat for a little bit. So thank you all.
Our global subcommittee chairs are not able to be at the meeting today, and I sit on that committee as well. I'm just going to give a very brief update. The global committee continues to focus on issues with women and girls and how we continue to lift up that work, and both learning what we can from what PEPFAR and others are doing in this space and what is transferable here and what might be transferable from us elsewhere. So continue to focus on that. We are watching the PEPFAR reauthorization process. We know this is a very important reauthorization, and you heard from Director Phillips a little bit about that yesterday. We are not in a position to advocate to Congress for anything. We advise the Secretary, so we're watching it very carefully and staying abreast of that. The other thing is that we will be needing a number of new members on the committee, with my rotating off of PACHA, and in September, Greg will also be rotating off PACHA. So we are looking for folks who are remaining PACHA members who might have interest, but we also know we have a number of folks who we hope to be able to bring onto PACHA real soon. So there will be folks there. So that's our quick update for the Global Committee. Moving on to stigma and disparities, Justin Smith and Raffaele Nerva.
All right. So our committee report will also be relatively brief. So since the last meeting, a lot of our focus has been on the stigma document that we passed yesterday. So that was where a lot of our energy was directed over the last couple months to just make sure that that was ready. And I just want to give a shout out to our members, Dr. Leo Moore and Rania Copeland, for spearheading that great work. So thank you for that. We also are continuing our ongoing work on molecular HIV surveillance. So I'll give a quick update about that in a little bit. And then the last thing is we also are going to be looking for new leadership for the subcommittee, given that myself and Raffaele will also be rotating off of PACHA in September. So I think we've going to have some new leaders, and I'm excited about that. So, but we'll be able to make that announcement in September. So just looking ahead, some of the other things that the subcommittee would like to do. Again, we're engaged in the conversation around workforce and specifically thinking about how do we make sure that minority-led CBOs are properly resourced for the work. So there'll be some work on that we'll do in the next couple of months. We're also interested in having a conversation around housing and also engaging in dialogue around the proposed national PrEP program. And that's kind of in conjunction with our partners on the EHE subcommittee. So those are the main highlights. I'm not sure if Raffaele is on the line, if he has anything he wants to add, or if there are any other stigma disparities subcommittee members that want to add anything that I might have overlooked. Okay, well, that concludes my report. Back to you, Mr. Chair.
So one thing I failed to say is I wanted to thank all the subcommittee members, but I also wanted to recognize that the EHE subcommittee and the Stigma and Disparities Committee relationship, has just been so solid. And I think we depend on each other. So I just wanted to also recognize your work, and it's been a pleasure to work with the subcommittee.
Great, thanks. And just because we're mentioning the number of folks who are rotating off, for folks who don't know, PACHA terms are appointment for a 2-year term, and that can be re-upped once. I'm looking to Kay to make sure I've got this all right. And then if members are not reappointed, you can serve up to another 180 days. And so a number of us are reaching that point in the reconstituted PACHA, which says a lot about how quickly 4.5 years goes by, I must say. So for those of you who are wondering what this is all about, we have specific term limits, and that's what they are. All right, moving on. So we're going to next very briefly talk about molecular HIV surveillance, cluster detection response, and I'm going to turn that over to Justin Smith, who co-chaired with Marlene the stigma or the subgroup of this work for the last 1.5 years or so.
Yeah, so I think this has been a kind of really intense focus for the council for the last 1.5 years, and this is an ongoing conversation. So just some quick updates from the last meeting. The main update I wanted to share is that we had a meeting with Dr. Jay Butler, who's at CDC. He is the senior advisor for infectious diseases in the Office of Readiness and Response, and he's the former deputy director for infectious diseases at CDC. And the purpose of that meeting was really just to elevate some of the concerns that we've had, and to go over some of the recommendations that we put forth in our resolution that was passed back in October, as a way to just continue to elevate this to the highest levels of CDC. So we haven't gotten a response yet from our CDC colleagues, but based on some of the information that Director Phillips shared with us yesterday, there should be some more information forthcoming that we are eagerly awaiting. We also know that there's been some kind of work in the academic space around this, so we'll be engaging with that literature as well to see if that points into some additional directions that we might want to take the work, and also, making sure that we're bringing in our community partners to those conversations as well. So not a huge update on that, but just to say that we hear the concerns and we're still in dialogue with CDC and other partners around this. So this work continues. It's still going to be a big focus for the work of stigma disparities as we move forward. And yeah, that's really the bulk of the update. John, what did I miss?
I think you did well. Just that we hear the concerns, and members of PACHA also share some of those ongoing concerns. And so we do want to keep the dialogue going. And we're very interested in engaging in a more active way, I think, with the White House office and CDC on the sort of look at the resolution. What they are indicating is in process, and doing that in a more transparent way, along with community. And I think that's their goal as well, but we need to make sure that we get there.
Yep.
And appreciate that. Okay, so that leads us to sort of our ability now in terms of discussions and reflections to think about our last 3 days together, our site visits, which were amazing, to reflect on what we were able to go out, see, hear, touch, feel, listen to, as well as process the presentations we've had here and the discussions. So this is the point where PACHA members reflect on that. What sort of are the key takeaways for members? And more importantly, with that, where does that lead us in terms of our work? Again, we are an advisory group, which I guess I also realized we did not sort of start the meeting yesterday with reminding folks our sort of purpose, which is to advise the secretary on essentially all things, let's say, HIV and AIDS, and we are an advisory capacity. We are not a policymaking group. We do not do programs, but we try to lift up issues, hear issues, and then think through what are those system and policy issues that, from a community perspective, we want to encourage either be done or looked at in the Department of Health and Human Services. So that's our role. And so with that, our reflection here is looking at what did we hear? What do we feel we need to elevate? Are there resolutions we need to be working on? Are there follow-up conversations that we want to have with our amazing federal partners who are around the table, who have been with us every step of the way in this reconstituted PACHA, which we appreciate. So that's really our purpose and time here, and thinking then, are there things that we need to be asking work groups to do? How does this inform future PACHA meetings in terms of either issues we want to hear more about, dig deeper into, that we just started hearing about here? So for PACHA members, we'll use the standard put your card up. We want to hear your reflections. We want to hear what you think should be priorities. And once we get through sort of PACHA members, we'll certainly invite also our federal partners into any sort of thoughts that you're seeing as well, and things that you might want to encourage us to be thinking about. So I'm waiting for that first brave soul to go with their card up. And also, I don't know, online, PACHA members that are online, I want to make sure that you are also engaged, and Caroline's monitoring that the way it looks, and so she'll jump in to let us know who's interested in sharing their thoughts. It's never been a shy group before, so who's going first? Vincent, I knew I could count on you. Oh, yeah.
So just a couple of thoughts, and then I'll sort of get to the matter at hand in terms of priorities. I think what I most appreciated about the meeting was really, this may seem obvious, but it was the very intentional focus on a particular community, American Indians and Alaskan Natives. And I think that for too long, we've been hearing about sort of sort of servicing limited resources. We've had an absence of knowledge and discussion about some of the unique needs. And I just think the meeting, I learned a lot, and I think it made me much more aware, a stronger advocate, and have much more proximity to being able to lift those things up. And so for that, I just want to say thank you to everyone that was involved in organizing this. I think the local context was phenomenal. There's so much good work going on. I'm sorry that what Dr. Cheever said about all the hours and all the ways in which programs operate, boy, was that reflected in the stories. And it's a great reminder, again, it's not sustainable, that we need a new way of doing this. And while I love the passion and commitment of the presenters, we cannot end HIV in our country or any health inequity just with depending upon sort of people doing more than what they should reasonably be able to do. I think Director Phillips, always a great presentation, reminds me of the challenges in terms of the LGBTQ community, in terms of PEPFAR and some of the areas that Director Phillips highlighted. Workforce. We got to come to that. I think that's a priority, John, and others. And obviously I was really inspired at how quickly and how beautifully, our sort of recommendation regarding syphilis, I think that was amazing. And so great work on the PACHA team. And then I would say the thing that I'm most sort of left with is, I'm not sure I have the right language for this, but I'm going to try. I think that there was some discussion yesterday about data, and oftentimes we are looking at data, but I think there's more that we can do around trying to understand the inequities in the data. And I would argue that going forward, that at some point in one of our upcoming meetings, we need to do a deeper dive, not just at a point in time, but looking at some of what I see as being pervasive patterns where some groups have been stagnating and not experiencing progress. Some groups have actually had worsening, and some groups have had progress, but it has been uneven progress. And while I understand that we are very much proud of all the terrific work that has happened nationally, and that overall we celebrate the progress, when I pull back a little bit of the curtain around that data, I see those three things. I see stagnation, I see uneven progress, and I see some groups where things are getting really worse. And I don't hear us talking about that.
Alicia.
Thank you. So I want to first say thank you to Southwest Center, Native Health, and the Phoenix Indian Medical Center for having us, as well as the organizations who presented here in person. Also, the great people of Phoenix, thank you so much for having us. I appreciate your warm hospitality and your welcome. So I'm going to speak of the visits that we had the other day. During the site visits, I was really in awe of the many programs that are available in the community, and very humbled to be in the presence of so many who have love and compassion, not just for the work, but for the people and the services that are provided. Something that came out to me was the phrase "people trusting people." That was said at one of the visits, and it really touched me because so many people have concerns with trusting, especially if there's been stigma, rejection, and any type of trauma that's gone on in their lives. But with that, it made me just think about people being seen as just that, as people, not as numbers, not as cases. And it was also shared several times about confidentiality being a huge barrier in the tribal community, especially when people are trying to go to visits and there may be friends or family, and there may be a breach of confidentiality. But within these organizations that I heard from and listened to, it's really clear that spaces are being provided for those to feel safe, to feel cared for, and treated with respect. And one thing I've noticed over the years for myself, watching the HIV epidemic, there were lots of signs. There were messaging around STDs prevention. I remember even going home, being able to watch the after school special and get a lot of education on HIV. We're not seeing a lot of that now. We're really not seeing a lot of that, which, I hear people say, well, this is still a thing. This is still going on. And a lot of the messaging is not as it was years ago. What I am looking forward to seeing is additional funding to become available for our tribal communities and their partners so that they can provide PrEP and PEP services a lot fuller, as well as care services. In that funding, that would also help with the advertisement and getting that information out to those communities who may not have access to it. Also, that funding also allowing them to be able to hire additional staff. I'm hearing that many are working over and extra to be able to supply the support that the populations are needed. So just looking forward to seeing that happen for those communities. Finally, in the community comments that were shared yesterday, something that I heard a lot of was the revision of the upper age limit from the CDC HIV testing for persons over the age of 64 who may be vulnerable to acquiring HIV. I would really like to see PACHA support any work that's going on towards those revisions. Thank you.
Thank you. So I wanted to start off just with talking about the session I was able to facilitate with the PACHA to the People session. I clearly heard about the need for providers to have ongoing learning opportunities about caring and treating older people with HIV, and the need to increase access to HIV prevention testing for all ages. Also, that alternative therapies should be covered in the Ryan White Care Act and under Medicaid, and the need to focus on rural communities. I really appreciated everyone's comments during that session. I also appreciated the opportunity to talk about my favorite subject, which is tribal sovereignty. That was the shortest, fastest presentation I've ever done on tribal sovereignty in my life. So I'm glad you all took a lot from that. I appreciate that. And I would say it's so important to provide presentations like this to everyone working in public health, not just tribal and federal officials, so that the government-to-government relationship and trust and treaty obligations are honored. I also appreciate the acknowledgments and outrage for the low funding to the Indian health system and the Indian health service, and how it doesn't even come close to the need. In our site visits and in the presentations, it was really great to hear about all the work being done in all communities, in Phoenix and the state and surrounding areas. And then just coming back to Mr. Curley's presentation yesterday, I was really reminded of the many beautiful and sacred LGBTQ and Two-Spirit people that I worked with in the late 90s and 2000s that we lost to AIDS. There were so many beautiful people that I called friends that I lost. It was definitely hard to hear about concerns related to patient confidentiality breaches and stigma that continues. That was happening 20 years ago. On a positive note, what hasn't changed is the passion and heart and the work of our frontline HIV providers at the site visits and all our presenters over the past 2 days. What we clearly heard is the importance of culturally and tribally focused care and how it supports the well-being of our people. Mr. Curley's tender, heartfelt, Navajo-focused care of his patient clearly exemplified this. And tribes often hear that cultural and traditional interventions are not evidence-based. I'd say us being moved to tears is evidence enough. So tribes should never have to prove that their cultural and traditional practices are evidence-based or have to be evidence-based to get funding. So I also just want to acknowledge your Chair Reisman, your departure from PACHA. I'll always remember your warm welcome when I joined PACHA and your commitment to honoring tribal nations, not just at PACHA, but when you were with Washington State. So thank you.
Thank you. Ada.
So it's really tough going behind such excellent reflections that I heard, and some actually were things that I wanted to mention this afternoon. But the one thing that I definitely want to take back with me from the presentations and hearing about the programs yesterday and also today is the importance, again, of trust. The importance of personal relationships, the importance of meeting people where they are, and the importance of storytelling and having that opportunity and the safe space to be able to do so. As we talk about workforce, there was something that, as I heard today from Dr. Cheever and others who, know individuals who are in this space and the time and the commitment that they place within their work, recognizing that in workforce is not just the numbers, it's also having individuals who have the love, have the compassion, have the passion, have the ability to ensure that there is care that is free of stigma, and also recognizing the importance of cultural humility. And so, it's really important that we take all those things into consideration as we move forth and as we look to the next generation of individuals who are caring for people who are living with HIV. So with that, I want to again thank John and Carl for all of your work and everything that you have brought to PACHA. And again, bringing PACHA to the people is really important. And we saw that here today, as we do with all our meetings. So thank you.
Thank you. Leo, then Justin.
Good afternoon, everyone. So first, I would like to thank Southwest Center, Native Health, Phoenix Indian Medical Center, and all of our speakers. Going out to the different sites is such an important part of our meetings and gives us such a great opportunity to see the work being done. And in all of those sites, I saw passion, I saw commitment, I saw pride for the work that's being done and for caring for people. So thank you. I wrote down a few thoughts that I had regarding some of the themes that I saw. One, resources may be lacking, but we'll do our best to meet the goals and service to our community. I completely agree with Vincent that, it's not sustainable that people continue to go above and beyond and, work past their hours, et cetera. So it just renewed this focus on strengthening the HIV workforce that I think we need to continue, discussing and continue developing strategies. So I was really happy to hear about the work that the CHAC is doing and how we'll be able to partner with the CHAC on that work. Another theme that I saw was meet people where they are and never give up on them. And just hearing Mr. Curry yesterday, and I was particularly struck by the one patient that he said was not yet ready to start treatment, but he continued to stay in contact with that patient. And so often when a patient's not ready, we don't have someone who's following up with them and just checking in to make sure that they're okay and to provide education in a way that doesn't, push them away, but invites them that when they are ready, that we are available to them. So meeting them where they are and never giving up on them. The third thing that came to me was infuse culture in everything we do. So hearing about the We Are Native program, the Healthy Native Youth, Chicanos por la Causas Luces, I saw and felt the culture from those programs, and I didn't even get to go and experience them, right? So that said to me, it's just so important for us to be thinking about culture and how we infuse it in the work that we do and how we keep it central to the work. Hearing Kelly yesterday talk about being connected to the land and being connected, it actually made me feel grounded in the work that much more. And, hearing more about the focus on that human connection and less around it being about data and numbers, but it being about us all being human, So that was another thing I took away. A few proud moments passing the ending stigma resolution, which we know that stigma continues to be a challenge, and it just continued to be discussed here during the meeting. And then also passing the syphilis resolution. I will say that in LA, we've already shifted to, mitigation measures, if you will, regarding using penicillin only for select patients and switching to doxy. So we're seeing the challenges, and I was glad to see that the team here, put up that resolution quickly. Also really appreciative of the PACHA to the people, just hearing from community directly. I heard quite a few things that, I think we need to continue thinking about. One, a focus on substance use in HIV. I heard that come up quite a bit. Housing and Papua came up as well that I heard, and barriers in many jurisdictions to getting people connected to housing. Also public charge. I heard that today as well. And I think that, we really need to take a look at that regarding barriers to undocumented people accessing services for fear, that they'll be deported or prosecuted. And then the last thing, testing for those who are 64 and older. So I was thankful to our CDC partners for sharing with us that is already being reviewed, and we as PACHA will continue to follow up and support however we can. Last but not least, I want to thank Carl and John for your leadership, for the amazing work that you all have done. And I know that this, at this time is the end of your time on PACHA, but I look forward to staying connected. And one thing that I've learned even, as a newer member of PACHA, that once you're a part of PACHA, you're always a part of the PACHA family, right? So thank you.
Okay. I think I'll just sort of echo a lot of what my colleagues have already offered, but I think just some of the things that I was really struck by, like many of you, I was really impressed with just how well so many of the programs that we visited and that we heard about were so reflective of the cultures of the people that they were intended to serve. And I think that just provided a really great model of how all of our programs should really look, right? And so That was something that was just very striking and beautiful to see. I also really loved how inclusive all the programs were of Two-Spirit and LGBTQ folks. And that was just a way to say they were all part of the same human family. And that was something that came through in all of the programs. And that was just another kind of beautiful thing to acknowledge. I also wanted to just notice something I saw in the room, which was that some of the presenters had been mentored by Laura Platero, right? And how this was a model of how you do mentoring and training up the next generation. And I just wanted to just call that out as something that I noticed. And that's a model that we should try to kind of replicate, right? We saw even in Dr. Soto's presentation about how they're training public health students to also kind of be in the space. And so I think there are a lot of best practices that were shared that we should look at trying to lift up and replicate where appropriate. I was also really pleased that we heard about kind of the challenges that we're having around syphilis and the bacillin shortage, and we took quick action around that. And so hopefully, that will kind of help grease the wheels a little bit and get a response going. And lastly, I think like many of us, we were so moved by Mr. Curley's presentation yesterday. I think just his manner of being and presenting was just so powerful. So I'll be thinking about his words for a very, very long time. The other thing that I was really struck by, and we didn't get to talk about it a lot, but in Dr. Soto's presentation, when she talked about the partnership that they had with the Gobierno de Mexico in getting the COVID vaccines to Mexican nationals as well as American citizens. And that was just something I would love to know how we can expand that to other kind of areas of our work. Really just recognizing that we're all part of one global community. And as she said eloquently that, diseases do not respect borders, right? But I thought that was a really, I'd never heard of that before. So that was a really eye-opening and powerful example of how we can come together as a global family. So just wanted to know and dream about what that could look like for other work that we do together. So those are just a couple of my reflections, but lots to process over the next couple of days. And I'm just really thankful for the time that we've had here together in Phoenix. And to Carl and to John, I've learned so much from each of you, and I know that we'll stay connected. And John, I hope you don't get too mad at me for wearing crimson and not blue, but but I appreciate all of your support throughout this process, and I'm looking forward to staying connected.
John.
Just a couple of quick comments. First, I was blown away by our site visits and to see what was being done in the American Indian community, both in person and virtually, to hear about the high quality of services, the client-centered care, the comprehensive, compassionate, culturally humble services that they were providing. To me, having worked with many of those folks for many years and to not have been aware of what they were doing and how they were doing it was really humbling, and it was just amazing. My mind was blown away by what they were doing, and cannot thank them enough for doing the great work that they're doing. And I would even say that to some extent to the panel that we heard today, where I knew that they were doing very diverse and interesting work in the community, but really didn't know the extent of the populations that they were reaching and the specifics of the work that they were doing. So that was wonderful to hear from them. In looking over my notes from yesterday, I believe during our public comment section, there was an individual who discussed advocating for PEPFAR funding and the importance of challenging the challenging of that funding and asking us to take action on that and hopefully drive some consideration forward on that. So I would encourage PACHA to continue to look at that at both the full PACHA and committee level. And then, John, Carl, and Kay, I co-facilitated with Laura, the PACHA to the People session yesterday. And I stood there for a little bit once we got into the conversation, and it was really hard to tell who was a PACHA member and who was a member of the public. Like, you had all intermixed so well together, and it just looked comfortable and engaging. And it, like, when you think about the parallels to the Ryan White program and CDC prevention programming, where everything is informed by the community and has to have representation from specific people and is really meant to be plain language and engaging and responsive to local needs, to see you all in that group having that conversation and really giving some great information that PACHA can use to take action on. It was just really exciting. And I think that that's a wonderful legacy for the three of you to share with us, because I know that that has not been the case perhaps in the previous PACHA iterations that I have known. And I think that that's just a wonderful thing that can be your legacy. So thank you very much for that.
Thank you. And no PACHA members online to speak. Okay. Carl and I are going to go last. So let me invite the federal partners for if you have any reflection. Oh, Caroline. Yes, let's open it up.
Thanks, John. Hi, everyone. Just a few quick comments. There's so much work behind the scenes, and it's so much fun to watch it come out. And so I just wanted to give a few shout outs. Laura Platero and Rick Haverkate helped so much. I think every Monday for like weeks, I just text Rick at 9, like, you ready to go? I think I sent them a different agenda weekly to help. And so it's so much fun working with you both a little bit more closely, and really appreciate all of the help. John Sapero really... Yeah. John Sapero, I think, sold himself a little short in the subcommittee updates. He's done so much work leading up to this meeting. He's helped so much, and I just really admire you, and it's been fun working with you for this meeting as well. John and Carl. I just can't, because I cried so much when I said goodbye to Secretary Sebelius, and I called Kay right away, and I was like, I have to quit. I can't. I cried because of the public. And so for you two, I love you both. So I'm just going to leave it at that. I want to thank a few local partners. We were really lucky to work with a lot of people from Phoenix and Arizona. I want to thank Captain Huddleman and her team, and Maria Dagger for all your help, and everyone else who really provided so much input, and really appreciate that. The HIV.gov team. And lastly, Kay Hayes. She is the heart of PACHA, and she is the glue of our office. And I love her.
Oh, let's see. Yeah. Okay.
Okay. If this sounds like a stream of consciousness rambling, it might be. Just a couple of things. Again, thank you to our hosts for allowing us to visit and learn. I really appreciate the opportunity. These PACHA to the People, I think, are really important opportunities for all of us to listen and learn. And when I've done these PACHA to the Peoples, it's always this moment sort of affirmation of things that you believe and things you think. And then there's moments where you're challenged, where maybe your belief is changed or broadened. And then you often are left with a bunch of questions, and things that you're still trying to wrestle with and figure out. And one of them for me was sort of, what does it really mean to provide services with cultural humility and to meet people where they are? What does that really look like? And I think this experience here provided some greater insight. into what that might look like. And kind of going back, I think, to what Justin was saying too about, so how do you do that for all folks? Really kind of opened my eyes to that. Some just general takeaways or things I've heard that resonate with me that I know I want to go back and really look more into. Obviously, HIV and aging came up quite a bit, and we've begun some work in that in HHS, but certainly much more to do in that regard. I was really appreciative of the almost seamless integration of the concepts of status neutral and syndemics, which had been sort of relatively new conceptual terms, even though the work had been doing for that for years. But we've really kind of elevated those concepts more recently on the federal level. And so to hear it locally was really kind of refreshing. PrEP demand generation. Obviously, we're struggling nationally around PrEP. And it's really important to sort of hear that really intentionally put out there for conversation, and really for all of us to sort of think about, how do we generate PrEP demand? And then what else do I have here? The projects, the examples, particularly yesterday, I was sort of blown away with all that's going on, but also sort of selfishly pleased to sort of see some of the work of the Minority HIV/AIDS Fund in action. And then on the sort of flip side, waking up today to read about the Supreme Court decision around affirmative action, it was sort of a reminder that those resources are not guaranteed, and that how we talk about serving communities of color and race really is going to be a challenge moving forward. And we're going to have to be really vigilant to sort of ensure that these funds remain, because they are not. They are certainly threatened. And I think the last thing was just really, and it's not a new thing, but sort of appreciative of watching the PACHA members sort of in action, and really appreciative of how they really take this charge seriously, and really appreciate all the work that they do. And so, thank you for the opportunity to tag along.
Any other federal partner, any reflections you want to share? It's not a mandatory, but I do want to make sure if you have anything you want to share, you have the opportunity to do so.
Sam said it better than I could, so.
Carl, let's go for you.
Thanks, John. Just wanted to reflect on my last 4.5 years, both being as a PACHA co-chair and a subcommittee co-chair. I was also on PACHA for a couple of years before. And so I think I've been on, I don't know who gets the record, but I've been on, I think, 6.5 years or so. But we've been through a lot, and particularly with John and myself. I remember the early days in the Trump administration, and they brought a renewed focus on HIV with energy and more resources, and we were excited, and that's why we took on this assignment, to end HIV. How could we not be part of it? And we wanted to help guide it, and I think that's what we tried to do. We were torn because at the same time they had all this energy towards ending HIV, they were also tearing down the ACA, Medicaid, and many of the people who are most impacted by HIV. So it's a difficult time. And, but I think we've accomplished a lot over those years in advising them. We put together a diverse group, and I know we got criticism for it wasn't diverse enough, but it is nice to see the improvements that the Biden administration has made to this body and the diversity. And it really has been wonderful to work with all of you and learn from you. And everyone has a unique perspective that we all need to be respected. I've worked with two co-chairs named John Weisman and John Sapero, and just wanted to thank you both. You bring unique talents, and you complete, I may have some strengths and many weaknesses, and you were able to both to complete those and make the team better. I think one of our number one priorities was to ensure community involvement. And I really want to recognize John Weisman in his skills and bringing people together. And John, I liked how you said it, how, just feeling so comfortable and, bringing PACHA directly to the people. But I think that was one of our signature achievements over the years, is to go out to the communities. And, we went to Jacksonville, we went to Miami, we went to DC, and then unfortunately we had COVID. And, but we did adapt and over those years. And I'm pleased, that I think that was another one of our main accomplishments, to hear from the community and what was needed to get through COVID. And then, and we adapted, and we still heard from the people during COVID, and that was remarkable. And then we worked on resolutions for the administration on what the community needed to get through COVID, those difficult times, and we learned to innovate. And I'm pleased, that we've actually come out better and stronger. And we even like telehealth, it's just remarkable, and teleprep. We worked on so many issues, and we advised on the national HIV/AIDS strategies, the ending the HIV epidemic, how to improve testing, how to, viral load, keep people, bring them into care and treatment. We worked on, PrEP and national PrEP program. We put together a resolution on that. We had many resolutions on that. And then we worked on all different issues like women, aging, HIV in the Black America, substance use, transgender. We went to Miami and we focused on Latinos, and we even focused on Puerto Rico, and they came to Miami. We also, difficult days in the Trump administration, we really took issue with their non-discrimination regulation and the rollbacks. And we made it a point to speak up for the community, and we met with the head of the Office of Civil Rights, and we didn't back down. And we're pleased that the Biden administration is redoing those in a much more a better fashion. One of the things that we've also did is to bring CMS to the table, and we organized a meeting with the administrator of CMS, and I hope that they will be a true partner, like so many other federal partners around the table. Another thing that we did is to focus on the private sector, and am pleased that did turn into the business council to end HIV. And I am an advisory member on that, so I'm going to continue on that end. We also worked on syndemics as well. So while there's so much more to do and many obstacles, and we heard so many of them here, and I'm going to continue to work as an advocate, but I believe we've made progress in the fight to end HIV. I think we have a new trajectory in our nation, and I know PACHA will continue to carry on with this work, ensure that our government is doing its job for all the people. And finally, I cannot end without thanking Caroline and Kay and all the HHS staff for all the support you provided to me and to PACHA, and I know you'll continue to do. So thank you very much. Yeah. Thank you.
Yeah, I'm not going to take much time here, I don't think. Carl really nicely outlined, I think, sort of what these past 4.5 years have been. And it is about the people. And the PACHA to the people has been really important to all of us. It was about the people for me why I stood up to do this when asked. Many would have said this would have never happened under the Trump administration. We had leaders who were passionate about this, to ending the epidemic happen. Dr. Redfield, Dr. Fauci, Admiral Riaki, we were there in the beginning, and it was about stepping up together for the nation, for the people, and for what we knew had to happen. And I'm proud that we did that. It's an honor to serve in these roles. And to do so with amazing folks, not just those at this table, but all the folks who are out in the community providing the services that we go visit, who are doing this every day on the front lines, doing the difficult work, who are holding the patient's hands, who are fighting for the local policies that need to be in place to assure people equal access, to assure that their voice is lifted up. That's what this work really is about. And all of us are in these positions temporarily, and that's the way it should be. It is important to bring many different lived experiences to this table. It's important to bring fresh ideas. There are thousands of people who deserve a seat at this table on this council. We intentionally need to have these terms so that those folks come on. We're going to have amazing leaders who are here. We have amazing leaders now who are going to continue. Some who are going to rotate off next meeting. So this isn't ending, but that's incredibly important. And I just want to say that's the way it should be. And I'm looking forward to seeing what you all continue to do, not only at this table, but in our communities. I'm excited that PACHA will be going to Appalachia, either West Virginia or Kentucky at the next meeting in September. We're still figuring that out. But that's what this is about. And I just appreciate the support that certainly Carl and I have received all around, from whether it's you all, the staff, the technical support, the people who make all of this happen, our contractors. These things don't happen alone. And honestly, the people who do the hard work are those people who help make this meeting happen. We throw out ideas, they take it, they run, they track down all the contexts that need to be, share what it is that we want to make happen, and with the council members, make it happen. So I'm incredibly grateful today. I look forward to the ongoing work. Yes, there are challenges out there, but we have to remember to celebrate the successes as well. We have to feed our souls, and particularly I think about the workforce, and Laura, you said it so beautifully. It was either earlier today or yesterday. I was just so moved because we have got to honor and respect our workforce. We've got to see to it that they have reasonable work hours for reasonable pay, and that we're going to support them in the long term. As a country, we throw money at crises. The crisis passes and there's another crisis and we pull the funding. We can't continue to let that happen. Our public health system is way too fragile for that, has been for some time. Our workers are, and honestly, the American people deserve better. So with that, I'm incredibly grateful. I think what we'll do, Kay, we're going to let you go last, I think. Is that all right? I think. Okay. Unless you want to go before the Admiral.
I'll go right quick.
Right.
I will be brief. And so much has been said, and to go at this point is incredibly hard. I'm incredibly proud of this PACHA, my staff that has, we have fellows and interns that have just jumped right in to help. And John and Carl leading with integrity, compassion. And so I'm going to stop there. But I want to say, Justin, something you said is like in my head. And Justin's like, let's just dream together. So our work continues, but we have a small token, just very small. Everyone just wanted to write their thoughts. And thank you. Yeah, you're welcome. Yeah. So, in my head, it was going to be much more eloquent, but it is what it is. I will say I'll end with this because Tim knows as a Wahoo and David knows as a Wahoo. I'm reminded of Emerson in that what lies before us and what lies behind us are smaller matters compared to what lies within us.
Thanks so much. All right. We are so honored to have with us Admiral Michael Wiacki, who I'm going to invite up to the table to do our closing remarks for us today. Admiral Wiacki is an enrolled member of the Zuni tribe, formerly served as the director of the Indian Health Service. As the director, he administered a nationwide healthcare delivery system that is responsible for providing preventative, curative, and community healthcare to approximately 2.6 million American Indians and Alaska Natives in hospitals, in clinics, and in communities all across this country. Admiral Wiacki, he previously served as the Chief Executive Officer for the Phoenix Indian Medical Center, the largest federally operated facility in the Indian Health Service. He was born in the Shiprock Public Health Service Hospital on the Navajo Reservation and grew up as a direct service user of the Indian Health Service. Admiral Wiacki began his professional healthcare career in the United States Air Force and as a military health specialist. Before going to the Indian Health Service headquarters, Admiral Wiacki helped to set up the HIV Circle of Excellence at the Phoenix Indian Medical Center. And perhaps most importantly, Admiral Wiacki served as an advisor and primary initiator in the earliest days of ending the epidemic. Welcome.
It's such a pleasure to be here with you all. I really want to thank you for inviting me. Since you're here in my hometown of Phoenix, Arizona, so very proud of our IHS tribal and urban partners who got to showcase the great work that they do each and every day. As a previous IHS director, just made me really proud. So I want to first say thanks to Kay. All this great work that you've done, and to the PACHA co-chairs, to Marlene and John, and to John and to Carl. Thank you for your leadership. Thank you for all that you've done to help ensure that this very important work continues and gets the attention that it needs. At the Indian Health Service, we're working hard to ensure access to quality healthcare services for American Indians and Alaska Natives living with HIV and those at risk for contracting HIV. And this PACHA to the people experience helps us to achieve our vision of healthy communities and quality healthcare systems through solid partnerships and culturally responsive partnerships. I just wanted to check, and I'm glad that I had the opportunity to hear the roundtable and the reflections on the week. How was your week here in Arizona? Did we leave a lasting impression that you'll take home? these are our ancestral homelands. I'm so glad that you got to hear the incorporation of how we are one with our land, and really the traditional and indigenous practices that so many of us who are caught somewhere between Western medicine and traditional Indian health practice, we take for granted, I think, because we live in it each and every day. But to be able to share that and extend it to a greater audience, I'm so happy that you got to take part in that. I'm also glad that I was among one of those first federal officials when I was director of the Indian Health Service at the very start of the EHE initiative. And thankful for this opportunity to be able to greet some friends who I haven't seen in several years. And Laura and Maria, I get to work with on a regular basis and have worked with them both for, it feels like a few decades now. But now as I enter into my 30th year of public health myself, our circle is small and we get to reacquaint every now and then, and we got to take advantage and appreciate every opportunity that we do get. So very happy to see you all here in my hometown. It took a little while and some intense work, but I'm glad to see that the EHE funds that we fought so hard for are making a difference around the country, especially those that are directed specifically to Indian country. In addition to the Minority HIV/AIDS Fund, the EHE resources provide significant support to the ongoing HIV prevention and treatment efforts provided by the Indian Health Service and our tribal and urban Indian organization partners across the country. Here in the Phoenix area, we constantly work to expand partnerships between IHS and the many different Native communities that we serve to end the HIV epidemic in Indian country. As you know, those partnerships include each of the individual tribes. We have a number of them here in Arizona, 20 across the state. We have several urban Indian health organizations, 2 right here in Phoenix, one that you got to visit in person, Native Health. We also have Native American Connections that does a lot of work in substance abuse, which we know what a challenge that is, as well as addressing the homelessness issue. And we have a Tucson Indian Center urban program, and up in Flagstaff, we have Native Americans for Community Action. So a lot of great partners working here, serving our Native communities. We also have partnerships with our federal, state, county governments, as well as our academic. We're fortunate to have a few medical schools right here, University of Arizona, Midwestern, A.T. Still, the Mayo Hospital System has a medical school here, and then some large programming in healthcare under the university systems of Arizona State and Northern Arizona. And we are partnering to address many of the challenges that you all have discussed here today, workforce being key. ASU has identified that they're going to increase by 4-fold the number of nurses that they're training. They just announced earlier this month that they're starting up a new medical school, and we are partnering on a community health worker training program as well to put more community health representatives and community health workers in our communities. As we all know, growing your own workforce from within your communities is key because you don't want to see people coming and going, and it's a lot more personal when you're taking care of your aunties, your nieces, your nephews. It's really a personal business once you get to that point of growing your own. I hope that it's evident through the site visits and the panel discussions and the various presentations over the last 3 days that the IHS and our tribal and urban partners have a solid presence, and we support PACHA's efforts to provide advice, information, and recommendations to the Secretary regarding the development and implementation of EHE and the National HIV/AIDS Strategy. IHS continues to address barriers for people living on Indian reservations, in other rural communities, and in our urban areas like Phoenix, where we have the 3rd largest urban Indian population in the nation right here. We know that stigma in Native communities can be a debilitating barrier preventing someone living with HIV, Hep C, or STIs, or at risk of these, from receiving the health care services that they need and deserve. So while we're using innovative tools such as telehealth to overcome these challenges and implementing the syndemic approach that I join you in saying, I'm so happy to see that we are getting that word out. I was also happy that you were able to see during your visit at Native Health their mobile clinic, which is another way that we're taking services to our patients where they live, where they work, and where they play. And you all got to meet Welberto. I know the video that Susan put together was great to kind of walk through that clinic on an empty Saturday and get to see a little bit more of how they infuse humor into all the work that they do. So these strategies are essential to help reach our patients who are most in need. We're also training clinicians in our public health workforce on the options presented by PrEP through clinical guidelines and various training materials. Back in August 2018, while I was serving as the director, we added PrEP to our national IHS formulary to reduce the risk of infection among those who are most at risk for HIV. And it's now available in the same manner as all other medications accessible throughout the Indian Health Service. As with any new initiative as an agency, we engage in tribal consultation and urban confer to seek input and work together on the implementation of programs and decisions that impact tribes and our urban Indian organizations. We continue collaborating with Native serving organizations to support and promote HIV screening, and we do our best to connect people living with HIV to appropriate and culturally specific care and treatment. We also continue to expand outreach, education, and technical assistance to tribes and tribal organizations to improve their adoption and utilization of HIV prevention best practices and models of care. So Kay, if we take a look, back in fiscal year 2018, IHS received a competitive $3.6 million award from the Minority HIV/AIDS Fund. 2019, IHS competed for and was awarded $7.9 million. And here we find ourselves now with 2022, and IHS was awarded over $11 million. So obviously our national HIV program is doing something right, and I'm sure that your office sees the benefits of funding Indian country through the Minority HIV/AIDS Fund. Throughout the Indian health system of care, we have more than 605 hospitals, health centers, and health stations serving, as we noted, 2.6 million American Indians and Alaska Natives who come from 574 unique independent sovereign tribes. So that's a huge geography. You got to see some of our best and our brightest right here in Phoenix. But as you might expect, there are great needs throughout the rest of the country as well. The activities supported through the Minority HIV/AIDS Fund build capacity, promote innovation, cross-agency collaboration, the integration of best practices in response to HIV among minority communities, and helps IHS and our communities respond to the national HIV/AIDS strategy goal of reducing HIV-related disparities and health inequities. The IHS distributes 100% of the Minority HIV/AIDS funds that we receive to tribal and urban Indian health programs around the U.S., enabling them to develop and conduct local, state, regional, and national HIV and Hep C education, prevention, and treatment programs like those that you got to see and hear about this week. The successes generated through the Minority HIV/AIDS Fund and the new EHE funds from Congress create lasting changes across the federal HIV prevention and care portfolio. EHE focuses on protecting people at risk for HIV using proven prevention interventions, including PrEP. And at IHS, our mission is to raise the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. And part of that mission is ensuring that our communities have the tools and the information they need to help protect themselves. I look forward to continuing to strengthen our partnerships and to building new collaborations as we work to end the HIV, Hep C, and STI syndemic in tribal communities and throughout the United States. Again, I want to thank you to our IHS headquarters HIV program, Rick Haverkate. Thank you so much. Our local IHS facilities who you got to visit, PIMC, Heather and her team. The tribal and urban Indian organizations, Native Health. I know Dr. Molina was there facilitating that tour. And also Maria from Intertribal Council of Arizona. Thank you. I also want to thank the PACHA in your leadership. Thank you for coming to Phoenix to spotlight the efforts that are being taken to end the HIV epidemic in Indian country. I want to wish you a safe travels back home. Alakwa, my thank you, and Zuni, and be well. Thank you for having me again.
And to the community, thank you for joining us. Thank you for participating with us. We look forward to seeing folks at the 78th Presidential Advisory Council on HIV and AIDS, September 19th and 20th, somewhere in Appalachia. And with that, we adjourn the 77th Presidential Advisory Council on HIV/AIDS.
Produced by the U.S. Department of Health and Human Services.